So now I invite Dr. David Pradeep, HOD General Medicine, sir. Balmurugan. Okay, Dr. Balmurugan, General Medicine HOD from Madurai Government Rajaji Hospital, to deliver sharing the experience on PLEX for rodenticide poisoning. We welcome you, sir. The stage is yours.
Pleasant morning to all. Here it's a great privilege to share the experience regarding the therapeutic plasma exchange at Madurai Medical College and Government Rajaji Hospital. And I am presenting this on behalf of my head of the department, David Pradeep sir, who could not come today. So this is a summary slide. So it's therapeutic plasma exchange started from November 22, from the first day of it started in our college also. Initially the emergency medicine was in charge. From March 2023 till date, Department of Medicine is in charge, and it's coordinating with transfusion medicine, nephrology, medical gastroenterology, all coordinate for the smooth implement procedure. And next slide, please. Yes. So the agenda for today, I will be sharing the experience based on the statistics provided from Department of Transfusion Medicine, General Medicine, and finally few lessons learned and take-home messages. Next slide, please. So this is the statistics from January 2023 till April 2025. Next slide, please. See, here you can see the month-wise patients who underwent the therapeutic plasma exchange. Totally in 2023, 97 patients were subjected to PLEX. And the survival rate in the year 2023 was 40% survival. And this is the total cycles and how many patients recovered. You can see the patients who recovered were less than the people who died. This is in 2023. Next slide. In 2024, the number of patients who required therapeutic plasma exchange came down. That is only 62 patients. But you can see the recovery rate was better in 2024. And the mean PLEX cycle per patient was 2.87. And survival rate increased to 53.22. Coming to 2025, next slide. Yes. Here you can see only 10 patients have been admitted for PLEX in this year, and you can see the survival rate is very much better. It is 70%, and there were no PLEX was done in February. So this is a very rare event in Madurai Medical College, and you can see that the survival rate is increased and PLEX per cycle is the same. Next slide. So I have summarized the data. You can see that 2023, the average number of patients per month who underwent this therapeutic plasma exchange is 5.1. It came down to 2024 3.1, and you can see this year it's only 2.5, and you can see the survival rate is slowly but steadily increasing. So this is a comparison. Next slide, please. So this you can see from 23 to 25. This is from the transfusion medicine data. You can see the total people who underwent PLEX was 169. Patient recovered was 79. Death was 76. And the survival rate is now 46.74. And you can see here in Madurai, apart from low volume PLEX, there was a conscious decision to also use standard volume PLEX in some of the patients. So I will tell about that later. So this is the summary slide for transfusion medicine. Next slide. So this is the data from general medicine. Next slide. So here you can see the total number of patients just from February 24 to March in 1 year. 263 patients of rat killer paste poison were admitted. This is the number of poisoning patients were admitted, male 162 and female 101. Next slide. And you can see the patients who are shifted, that is, who develop some symptoms which may warrant him to go into. So 115 patients out of 265 shifted to toxicology ward, and out of that 59 patients didn't have any indication, where PLEX was indicated in 56 patients. Next slide. And you can see, as already pointed out, the most common age who have consumed more poison or who come late is in between 20 to 29 years. So if we just take less than 39 years, they contribute to about 80% of patients who are needing the PLEX or who will have the severe disease. Next slide. And this is the PLEX indicated cases, male, female. You can see in very younger age, females dominate. So when it is less than 20 years, most of the patients who come with severe disease is females, but after that, it is equal sex distribution. Next slide. And here you can see, among these 56 patients, only for 40 patients PLEX was initiated, and most of the patients were in 20 to 29 years. Next slide. And here sex distribution. Again, you can see the number of patients, number of females or more when the age comes less than 20. Apart from that, you can see relatively equal male, female. So this is 40 people were subjected to PLEX in the last 15 months. Next slide. And here you can see the outcome. So the outcome in the 50%, it was 50% people recovered and 50% died. And you can see the most deaths also occurred. 16 deaths among the 20 deaths occurred in that age group of less than 29 years. Next slide. So this is the summary. So among 263 patients from January 24 to till date, there were 263 patients who were admitted with rodenticide poisoning. 36 people died. In 36, among the 36, 20 were the people who underwent PLEX. So if you consider the whole mortality, it is 15%. 15% of rodenticide poisoning, whether subjected to PLEX or not, they die. Next slide. So this is what I want to highlight. So 124 patients among 263 patients were referred from these districts. And these districts don't have PLEX in their medical colleges. And you can see 35 patients were referred from Sivagangai. And the Sivagangai Medical College or in Dindigul Medical College, there is no the facility for PLEX. Even within Madurai, 42 cases. So these are the number of cases which we get from other districts. Next slide. And you can see when they come within Madurai, direct admission at Madurai, the mean time is only 2 hours. But when they come referred from other GH, it takes up to 3 days. So many times when he comes, he is in acute liver failure, or he will come in encephalopathy, or he has been discharged, went home, then again brought. Because it is delayed, that was not properly sensitized, or they thought he is normal, but he comes with a great delay. So this tells that we need to have PLEX in all districts. Next slide. So what we did in Madurai is, from 1 March 2023, the NHM protocol or the Indian Society of Gas was followed, but the outcomes were not satisfactory. So in 12/6/23, an internal meeting with general medicine, nephrology was, and they slightly tweaked the protocol. So next slide. So we made the, next slide please. So even the rising enzymes, we didn't wait for INR go to 4. So even rising enzymes individualized based on the quantity taken. So even rising enzymes, even before INR was 4 was considered, and even some of the patients, based on the various studies available that time, standard volume PLEX also was used. And based on that, we found that outcomes were better. Next slide. And these were the thing which was formed in 2023 March. So a dedicated team consisting of postgraduates and assistant professors. So the team initiated PLEX within 1 hour of admission, and the indication is present. Within 1 hour it will be started. All MD postgraduates were trained in central venous catheterization to ensure timely vascular access, and the emphasis was on early initiation and intensified PLEX, I will say what it is, and also there was a monitoring of lactate, pH and INR, and the initiation of CRT, especially in patient with hyperammonemia and hyperlactatemia, was very much well received, and many patients after CRRT, then they came to PLEX and many of them survived. Next slide. And these are some of the take-home messages. It is still common. It is available in many stores. It is, as already pointed out, in Amazon, even today it's available. And many places it seems to be very toxic to rat also. So people want it. So it is still very much available. They are hoarding it. The incidence is falling, there is no doubt. But regarding the plasma exchange, after the availability of plasma exchange, the mortality has considerably fallen to the extent of up to 70% of the patients who already pointed out in various criteria survive. Next slide. And with individualization of the treatment and sharing of the new knowledge, mortality is better, especially patients with encephalopathy where the PLEX was prolonged duration. We have 3 instances where patients were given PLEX for prolonged periods. So where the renal function was normal but patient was in encephalopathy, they fared well after the prolonged PLEX. And according to our institution, hypotension has the worst prognosis. And when they have hypotension and renal function, the SLED and the CRTT was used after the expert opinion from the nephrology. And when we use that appropriately, even that hypotension could be managed better. So the take-home message is the transfusion medicine, anesthesiology, medical guys, if they work as a team, there is a winning. There is always a win, and nearly 70% mortality reduction with this PLEX is very considerable. As pointed out by the first speaker, even one death is a bigger thing. Thank you. Thank you for the opportunity. We have, and I also request that if any other further studies, we can include Madurai Medical College also. We have a lot of cases and we are also willing to be part of it. Thank you so much.
Thank you, sir. Thank you for sharing your valuable experience on using this therapy for managing the rodenticide poisoning.